Hello, everyone, and welcome to the fourth in our Pathways Breast Cancer Survivorship Study webinar series, Breast Cancer, Diet, and Heart Health, How the Pathways Study is Informing Lifestyle Medicine. Before we begin, I want to share that the slides are available to download on the website, there will be links sent in the chat for people to access our website and other information. There's a live transcript or captioning available if you see that at the bar down at the bottom of your screen. If you'd like to communicate with us, please use the Q&A to ask questions. We really want to encourage questions and for people to reach out if they have anything that they want to share or learn more about. The chat's view only, but we'll be putting resources there. The webinar is being recorded, and the recording link will be emailed to everyone who's registered. This is an hour-long webinar, but we may stay longer to answer some of your questions. So feel free to leave at the hour if you need to, or if you have some extra time and there's more questions, then we'll be able to address them then. I'm your moderator, Leanna Hartmore, and I'm Zero Breast Cancer Program and Communications Director at Collaborative for Health and the Environment. We've spent 28 years bridging communities and researchers and creating educational resources for kids through adults to reduce the risk of breast cancer and support survivors' health and wellness. We also have a health and wellness coaching program that I'll tell you more about later. Sign up for our emails for more information about our resources and programs. The link is in the chat. I want to give a shout out to our Pathway Survivorship Study Community Advisory Board, which is facilitated by Zero Breast Cancer and a team at Kaiser Permanente. The Pathway Study is a prospective cohort study of women diagnosed with breast cancer, and its CAB is made up of Pathway Study participants and breast cancer advocates. They give input on research priorities and community education, including giving input on the information shared today. You can learn more about the Pathway Study in the chat. And our first speaker is Isaac Ergas. He's staff scientist at Kaiser Permanente Northern California Division of Research. His research explores dietary, lifestyle, and behavioral risk factors for breast and bladder cancer, investigating how nutrients, food, and overall dietary patterns influence the mechanisms that impact cancer progression and survival. Dr. Ergas earned his PhD in epidemiology from the University of California, Berkeley. I'll pass it on to Isaac now.
Okay, hopefully you can all hear me and see me. I'll just start by saying thank you so much for joining us, and Liana and Zero Breast Cancer, thank you so much for setting up this forum and providing us an opportunity to share the findings from our study that we've been working on for so many years now. Today I'm going to talk about diet and heart health in breast cancer survivors. And I'm going to try at the end to link it to lifestyle medicine, which I will then pass over to my colleague, Robin, who will share a bit more about that.
Isaac, the black box is showing up on your screen. Can you minimize it like you did earlier?
There we go. How's that?
Perfect. Thank you.
Okay, great. Thanks for that. Okay, so just by way of background, just to say that, there are currently it's currently estimated by the American Cancer Society, oh, there it goes again, I don't know why it keeps coming down, that there are over 4 million breast cancer survivors in the US, and this number is estimated to increase. And in fact, by the year 2030, they estimate that there'll be up and around 5 million women with breast cancer in the US. And this is mostly this may be due and mostly due to increased awareness, increased screening activities, and improved treatments. And so while women living longer with their breast cancer is great news, it does seem to come at a cost. There it comes again. In our study, we found that women with breast cancer face a higher risk of developing cardiovascular and cardiometabolic outcomes. And these are two studies that we have published on this topic. And by cardiovascular, I mean diseases related to the heart, like heart failure and cardiac arrest and things like that. And cardiometabolic, I mean risk factors for cardiovascular disease like hypertension, diabetes, dyslipidemia, of that nature. And the general thinking is that women with breast cancer are at higher risk for these outcomes potentially because of cardiotoxic treatments that they go through during their breast cancer treatment, as well as potential common risk factors that both heart disease and breast cancer may have. So what is the Pathways study? Well, it's, as Liana mentioned, it's an ongoing prospective study of women diagnosed with invasive breast cancer at Kaiser Permanente, Northern California, between the years of 2005 and 2013. And here on the left is a geographic schematic of where our participation rates are for this study. The darker purple, like Contra Costa County and Alameda County and Santa Clara County, Sacramento, is where our highest numbers of participants are. Some of the lighter color, like Fresno, El Dorado, is where we have less participants. We enrolled about 4,500 women, and here you can see some of the eligibility criteria to be in our study. Things like being obviously a KP member, a Kaiser Permanente member. They had to live within 65 miles of an interviewer. It had to be their first invasive breast cancer. They cannot be a recurrence, and no prior history of other cancers. The average time from diagnosis, this is a timeline in months, and the average time from the breast cancer diagnosis to enrollment in our study was about 2 months. And at which point they did a baseline, they completed a baseline questionnaire, several baseline questionnaires, in fact. And they also provided specimen blood at that time. And we then followed them up at 6 months, 12 months, 24 months, and we continued over 48 months, 72 months, 96 months, and we continue to follow them up periodically today. So really the Pathways study main objective is to, as it says here, to investigate and understand breast cancer outcomes while focusing on things like diet and physical activity, complementary alternative medicines like herbal remedies, social and built environment like access to parks and resources. And we also have a large molecular and genetic component to the study. Let me just take a moment real quick for this announcement. I just want to state that the new Pathways study is now live. This is a website that we have been working on for quite some time. And if you visit here and visit often, you will be able to see lots of great information, study description. There's some interesting data visualizations using the data from our study. There is a data center. If you are someone who is a researcher or wants to collaborate with us, that would be the place to go to learn how you can do that. You'll also find here all the latest news stories, the new publications that are coming out and news stories around those publications, access to our webinars like the one you're in right now, an archive of all our newsletters that we typically send to our participants, and a ongoing list of our current publications. So please have a look at that. And we will be making continued updates as we go forward. So coming back to our findings, one of the questions that we're very interested in the Pathways study to think about is healthy eating. And so the question is, in this case, for this particular analysis, is healthy eating associated with cardiovascular and cardiometabolic outcomes in women with breast cancer? And that is what we set out to learn. And just to say that there are different ways that we can study diet. We can look at nutrients, Lots of studies focus on specific nutrients. We can look at food groups like meat, dairy, vegetables, things like that. And we can focus on dietary patterns. And so dietary patterns, what they are is they are kind of the entirety of what people consume. And you can imagine, I'm sure you're familiar with like a vegetarian diet, gluten-free diet, Western, plant-based. We hear all sorts of different types of diets. Each of these can be considered a dietary pattern, and that's what we set out to use here in this analysis. Right, and so here dietary patterns are the quantities, proportions, variety, or a combination of different foods, drinks, and nutrients in diets and the frequency with which they are consumed. So it tries to get the whole picture of one's diet, not just looking at one particular food or one particular nutrient. And what we can do is we can try to measure how similar one's diet is to a dietary pattern by creating a scoring index, and then give a participant a score based on how close they are to that particular dietary pattern. So for example, if we're here, I'm showing you an example of the DASH eating plan. It's a dietary approaches to stop hypertension. This is a dietary pattern that was introduced in the 90s specifically to address hypertension. And you can see this pattern encourages eating fruits and vegetables, whole grains, low-fat dairy, fish, and so forth. And it also suggests foods to limit. And so for the encouraged foods, those people, those participants whose diets, whose intake of these foods were more aligned with this particular food item, they would get more points than someone who did not. And likewise with the discouraged foods, if you're eating more of the discouraged foods, you're going to get less points for that food item. And then we would just sum up all those food item scores to create an overall DASH score. And so we created 5 diet quality indices concordant with healthy eating, aligned with healthy eating, using similar processes for each of these, though each of these different indices had a different potentially different way of calculating the overall score. And it also potentially addressed different types of foods. So I already mentioned the DASH diet. We also looked at the Healthy Plant-Based Dietary Index, which is an index that encourages non-animal food consumption. We looked at the Healthy Eating Index, which is an index that is aligned with general guidelines for healthy eating from the USDA. We looked at the American Cancer Society nutrition guidelines. These are guidelines presented by the American Cancer Society, as well as the alternate Mediterranean diet, which many of you may be familiar with, which is aligned with the dietary practices of those countries that are in and around the Mediterranean. And in each case, a higher score for this index indicated a greater alignment with that index and is suggestive of having a healthier diet. So I'm not going to go into the details here, but here's just a quick look at comparing the different food groups for each of these different dietary indices. And you could just kind of quickly glance across and see that there's a different scoring system for each one, as well as you can see foods that are encouraged. You can see right away fruits kind of traverse the entire all 5 indices. Vegetables do as well, whole grains. And down here in the discouraged section, you can see that red meats and refined grains and so forth seem to traverse, all 5 indices. But of course, each one has some of their own nuanced foods that it addresses as well. So in this particular analysis, there was 3,415 pathway study participants who were included. Each of them filled out a food frequency questionnaire, kind of like what you see here, but this is just a sample. It's much longer, and it addresses how often and how much food they consumed for each of these different items. And we had to exclude folks that didn't, fill out a questionnaire like this, or potentially their questionnaire had a total consumption of food that was potentially not a realistic measure. But in the end, we went forward 3,415 participants. These are the cardiovascular and cardiometabolic outcomes that we looked at. So here under the cardiovascular outcomes, you can see we looked at ischemic heart disease, heart failure, cardiomyopathy, stroke, arrhythmia, etc. Cardiometabolic outcomes, we specifically looked at hypertension, diabetes, dyslipidemia. So dyslipidemia being, if your, lipid levels that are kind of outside what is considered the normal range. And just to say that we took into consideration several other risk factors that could potentially affect the results. So all these risk factors you see up here are all risk factors that could potentially influence heart disease. So just to say that we took these into consideration when doing the analysis and getting our results. So what did we find? Well, we found that healthier diets, that is greater concordance with those indices at the time of diagnosis, were associated with a 25 to 50% lower risk of heart failure, arrhythmia, cardiac arrest, valvular heart disease, and venous thromboembolic disease. And the reason there's a range in the risk, 25 to 50%, because that depended on which index you were looking at and which outcome. But that was kind of the overall range of lower risk. And then just to say that while all the indices showed associations with these outcomes, the diets most aligned with the DASH diet in this context seem to have the strongest association with cardiovascular outcomes. And then we also found that healthier diets at or around the time of diagnosis were also associated with a 30 to 40% lower risk of hypertension, diabetes, and dyslipidemia, and that diets most aligned with the healthy eating index in this context showed the strong associations with cardiometabolic outcomes. And just for those of you who like graphs, I'd like to see data in graphs. This is just, you can see that this is for the healthy eating index, different levels of concordance with the healthy eating index. So the red line representing those participants who had the least amount of alignment with a healthy eating index, and the black line for those who had the highest alignment with the healthy eating index. And here you could see over a 15-year period, those with the highest alignment with the healthy eating index had the lowest incidence, or the lowest, had the most benefit, the least amount of outcomes that we were, in this case, diabetes. And of course, those in the red had the worst. So key takeaways from this is that in general, healthier diets at breast cancer diagnosis were associated with a 25 to 50% lower risk of cardiovascular and cardiometabolic outcomes. DASH and HEI appear to provide the most overall benefit. So what does this mean for you, someone who is perhaps choosing foods to eat? Well, what I want to share is that I think it's important for us to think about what kinds of foods do we see that are encouraged across, all these guidelines. And what we find is that these are the foods that that are encouraged. Things like, and maybe it's no surprise, but things like fruits and vegetables, whole grains like whole wheat and oats and quinoa and things like that, as well as nuts, legumes like beans and peas and soy. And if you are wanting to have dairy in your diet, perhaps considering a low-fat option, which is really only found in the DASH and HEI indices out of those 5 that I mentioned. And then likewise, there are discouraged foods in common. So red meat is discouraged in all of the indices, and red meat also includes pork and veal and things like that. Processed meats, which are any meat that has been cured or preserved in any way. That includes lunch meat or bacon or sausage, any of those kinds of meats, as well as added sugar, like especially in sugar sweetened beverages. And then also both DASH and HEI also discourage consumption of sodium or salt. So where do we go from here? Well, it is our belief, and my belief, that diet quality assessment, that is, assessing diet, should be encouraged as part of the standard clinical intake process at the time of breast cancer diagnosis. And this is something that my colleague Robin and I are working on right now, trying to get a study up to work on that. And she may be mentioning a little bit more about that, as well as, in addition to diet quality assessment at baseline, at diagnosis, diet monitoring and quality improvement over the course of a breast cancer survivorship should also be encouraged. And so it's at this moment that I want to kind of make the link to lifestyle medicine, which Robin is going to talk more about. But that this is just one piece of the puzzle in this idea of lifestyle medicine. And that there are these other domains that are also equally important, and together with diet can be a very powerful way to improve prognosis. So I'm going to stop there and pass it off to Robin.
Thank you, Isaac. I just want to check my sound. Liana, can you give me a thumbs up if it's good?
Okay. Yeah, it's good. And let me introduce you real quick. So Dr. Robin Zwerling Baltrushes is a physician of breast cancer at Kaiser East Bay, a breast cancer survivorship provider, chief of health education East Bay, and lifestyle medicine medical director at the East Bay. She's been practicing at the Oakland Medical Center since 2012, and I'll pass it on to her now.
Awesome. Can you see my slides okay?
Yes, perfect.
Okay. I am so happy to be here with all of you. And this month in particular, my clinical work is in the breast clinic at Kaiser Permanente in Oakland. So this issue is near and dear to my heart. And I really love to have this opportunity to link two things that I do a lot of work in. So breast cancer survivorship and lifestyle medicine. My last name's super long. All my patients call me Robin. So if there's any time that comes up, feel free to call me Robin. This is me. And this is just something to think about. There's not, a live chat feature right now, but just to start thinking about, have you heard of lifestyle medicine? So Isaac's gone over a little bit there, but just to kind of think about that, because when we think about lifestyle medicine, when I first learned about it, I thought, oh, that's like spa water and yoga or something. But it actually is something that you can get board certified now as a medical specialty. And I want to sort of have this opportunity to kind of go through this thought experiment. So imagine that there's a new type of medication. This medication prevents high blood pressure and many types of cancer. It treats high cholesterol. It reverses type 2 diabetes. The side effects are improved sleep, stronger immune system, and a better mood, right? So if this is a medication, I would love to prescribe this to all of you. It's a bit tongue-in-cheek, but what we're looking at here is lifestyle medicine. So lifestyle medicine is an evidence-based approach to preventing, treating, and even reversing disease by replacing unhealthy behaviors with positive ones. And we'll kind of go through each of the pillars here, but generally, eating a healthy diet, being physically active, managing stress, avoiding risky substances, getting adequate sleep, and having a strong support system. So we're going to be going over each of those in a little bit more depth. The other thing I like to say when we're thinking about lifestyle medicine, in medical school, we're taught about this. It's the first treatment for many chronic diseases, but we often skip right over that and go into the medication stuff. So, more than 80% of chronic conditions can be prevented or treated with a healthy lifestyle, things like diabetes, heart disease, heart attacks, strokes, high blood pressure. So, we want to sort of get back to the basics in a way. What do we do first before we start adding interventions and medications? We also know that our habits in our life can start early, 5, younger. Like these things can start very early and they can profoundly affect our health. So I like to tell my patients to focus on these healthy habits as a family. Everyone can benefit. Let's think of it as sort of a change today versus a medication or a medical visit tomorrow. Another visual to help kind of really drive this home for lifestyle medicine. This is a graphic that I really like. So these are two doctors, right? And they're both mopping up that water, trying to get that water off the floor, but neither of them has thought to look at the faucet and turn that faucet off. So when we think about lifestyle medicine, that's kind of one of the things we're really thinking about. What's the root cause of disease here? And how can we address that? We're going to get into the pillars, but I think this part is important because sometimes as I go into the pillars, it can be a bit overwhelming, especially if you've been thinking about making a change. You know, there's something that you've been wanting to work on that's been maybe hard to get the support you need. And if I go through all the pillars, it can feel overwhelming for some people. So I want to just really make it clear that we know when we make habit change or lifestyle change, it works best if we take off small pieces at a time, right? So we think of healthy substitutions in our daily diet or small goals that are attainable. As we reach these small goals, we build confidence, and that gives us this energy to move forward, right? So this is an example of that. And I want you to, if you have a pen available, or you can just think about it, kind of write down something that maybe you've been thinking about that's really specific. And I'm going to give you an example so that you can kind of think about what it might be for you. So the example is, when situation X arises, I will perform response Y. So here's an example for me. I have 3 small kids. After I put them to bed and after I eat dinner, I'm exhausted, and I often want to just like go eat a bowl of ice cream or a piece of cake or something. But my statement, right, to try and work on that is, if I get hungry after dinner, which is going to happen because that seems to happen every night, I'm going to take 5 deep breaths, because maybe I'm not actually hungry. Like maybe I'm just stressed and I'm looking for those carbohydrates to sort of like ease that stress a little bit. So I'm going to take 5 deep breaths. If I'm still hungry, then I'm going to eat an apple. I'm going to have a plan. I'm going to write that plan down on my Post-it. I'm going to stick it in the refrigerator or in the cupboard or anywhere that I'll see it. I'll tell my partner that I'm working on it. Like, you know, I'm really trying to do this thing after dinner. Can you help me? Maybe remind me to look at my Post-it. I'm going to get that extra support. And then to activate the sort of habit forming mechanism, we know that you really need that alternative response rather than a non-response. So you can't say, if I get hungry after dinner, I'm not going to eat cake. It doesn't work. It depends on willpower. And at the end of the day, most of us are exhausted. And then we just feel bad about ourselves for not having the willpower to succeed. So we want to have, they say, skill power, right? So we want to have a plan. So when the situation unfolds that we know happens on a regular basis, we're ready with a plan, right? I have to buy the apples to have them available. So if I make this plan and then I have no apples available, it's not going to work. So while I'm talking about these different pillars, just consider for yourself something that maybe you have been working on. And if you can get it real specific and write it down, that can be something that you can kind of take home with you today that you can work on. Okay, so here are the 6 pillars. We'll go through each of them. They're in no particular order. They're all very important. So physical activity, we basically want people to engage in regular, consistent physical activity. The recommendations, the sort of health goal that I have for my patients is 150 minutes of moderate intensity activity a week. That could look like 30 minutes of brisk walking, where you're like on the phone with a friend and they could tell that you're walking. So 30 minutes of that kind of walking 5 times a week. You're going to get 99% of the health benefits of exercise if that's where you start, if that's all you do. And then on top of that, there's sort of not really an upward limit of how beneficial it is for you. So we want you to be active. And if you are doing that already, then adding more is great. And this is each one. I'll have like an interesting fact. So the interesting fact for this one is only half of adults get the physical activity they need to help reduce and prevent chronic disease. And getting enough physical activity could prevent 1 in 10 premature deaths. So why does it matter? This is kind of a review, but particularly in patients with a history of breast cancer, we know that being active decreases the risk for breast cancer. We also know that regular physical activity helps regulate hormone levels for my patients that are on things like tamoxifen. One of the main interventions that we can really offer people is guiding them on increasing their physical activity to manage some of those side effects. Reduced risk of disease, improved mental health, improved fitness and mobility, healthier aging, stronger bones and muscles, and feeling better, right? So often if you can find the right physical activity, you can feel a lot better in your body, and that makes you want to go back for more. Okay, the next one is managing stress. This is, I don't have a magic solution or pill for this one, right? But, and it's different for everyone. One thing that I encourage people to do in my classes is, again, make a list of some of the things that have worked for you to manage stress, because they can be hard to access when we're under stress. So if you can make a list now while you're sitting here, like take a bath or go for a walk, these sort of things, they can then be accessible to you when you're actually under a lot of stress. There's a lot of evidence around this, particularly meditation, the gratitude practice. They've studied things like 20-second hugs and laughter. Managing stress is very broad. Physical activity certainly is helpful, but again, it's very individual. So I would encourage you to think about what that means for you. And why do we care? Why should we manage our stress? So the truth is that if we can manage our stress, we're going to decrease our risk for many types of physical health problems, things like stroke, type 2 diabetes, heart disease, and it reduces the risk for mental illness if we're able to manage that. Improves sleep, supports a healthy weight, and improves resilience. So there's lots of reasons to manage stress, and I think that probably most people can appreciate that, and I encourage you to think about what that means for you. The next one touches a little bit on what Isaac said, and I'm just going to say, when I teach this, we have 2-hour classes or very long series on healthy eating. In the context of lifestyle medicine, what we're recommending is a whole food, plant-based diet, which is pretty consistent with a lot of the information that Isaac just shared. And I really try to focus on my patients about doing sort of 80% whole food, plant-based, and then 20% maybe those non-negotiables for you. I don't know, dairy milk in your coffee, the occasional hamburger. But really, we want to have the majority, the star of our meals, be whole grains and healthy proteins like tofu and beans. And I'll give a little bit more information about that. But before we jump in, we still have an active guessing feature, but I just want to share this because I think sometimes it can be overwhelming, right? I just told you that I want you to eat, 80% of your diet be whole food, plant-based. That can be a big change. But maybe we can just think about what percentage of adults meet the daily fruit or vegetable recommendation in the United States. So across the United States, what's the percentage of adults that meet the daily fruit or vegetable recommendation that's made by the US government, right? So it's pretty low, only 12%. So even if, you're not ready to make these big changes, if you are able to sort of just move the needle a little bit towards eating more of those things, like the fresh fruits and vegetables and whole grains and beans, that would be awesome. And this is very person specific. About 5 servings a day is what we recommend, usually more heavy on the veggie side and a little less on the fruits, maybe 3 servings of veggie and 2 fruit. But that also can vary depending on each person. So generally it's about 5 a day. And this is another visual that I really like because I think we think of the standard American diet. So that's here under what America eats, right? That's the standard American diet. This is certainly the things that my kids want to be eating all the time and that are very available in our communities and our workplaces. But these things increase the risk for obesity and then type 2 diabetes, heart disease, some cancer. So how can we sort of change our eating patterns to include more of the foods on the other side of the screen under whole food, plant-based eating, right? So these fresh veggies, healthy beans and nuts and seeds. And we just want to try and move that needle so we can incorporate more of those things in our regular diet. So why does it matter? Who cares? So if we eat that healthy diet, we're going to reduce our risk for chronic disease, increase our ability to fight disease, help achieve a healthy weight. We can reduce the risk for cancer, including breast cancer and breast cancer recurrence. So in my counseling for my patients, I definitely recommend a whole food plant-based diet. And as Isaac said, the biggest bang for your buck is going to be reducing the processed meats, the red meats. If you can really reduce those, that would be the biggest first step. And it can be the first step, right? Because some people are eating beef many times a week. So the first step might be to eat more, other proteins like chicken or fish. It also prevents nutrient deficiencies when we're eating that healthy, balanced diet and improves energy and well-being, right? So people generally feel better on this diet, and so it's not super hard to convince them to keep doing it. The next pillar is avoid risky substances. Now, this is a pretty broad category. Generally, we want to reduce or eliminate the consumption of any substance that causes harm or physical damage or adverse side effects. So the general thing they're talking about in this teaching is the most common things like alcohol and smoking, but there's definitely other risky substances, and that's going to be very person dependent. I also like to include social media when I'm talking to my patients, because I feel very strongly that social media often sucks up a lot of our time and often makes us feel worse after we engage in it. If it's not that for you, if it makes you feel great after, awesome. But maybe start noticing how much time you're spending in front of your screen. The average American spends 7 hours and 3 minutes a day in front of a screen for non-work related issues. So that is pretty remarkable, right? So that's just for the time, their personal time in front of it. So I think that it's just something to start paying attention to and being mindful of how much time you're actually spending. So these are interesting facts really targeted in on alcohol and drinking. There are 16 million Americans living with a disease caused by smoking, and drinking is responsible for 1 in 10 deaths among working age adults. Particularly my breast cancer survivor patients, I really try to make it clear that we really cannot recommend any healthy amount of alcohol, specifically when it comes to breast cancer survivors. So we really want to minimize that as much as possible. There are no health benefits of alcohol that make it worth drinking. We can't say that it's good for your heart, and we really want to be thoughtful about how we're consuming alcohol. So why does it matter? This is pretty basic stuff, but when you quit smoking, our bodies are miraculous. Your lungs, heart, and circulatory system can begin to function better, like a day after. We're less likely to have a heart attack or stroke, less likely to develop cancer, going to breathe more easily. And when you quit drinking, you're less likely to hurt yourself or someone else by driving after drinking, less likely to injure yourself, less likely to develop cancer, liver damage, immune system disorders. So there's a lot of benefits to quitting drinking, and especially in our breast cancer survivor patients, because when we can minimize the alcohol consumption, we can also reduce the risk of breast cancer and breast cancer recurrence. Okay, and then the next one is relationships. So relationships, we really saw this as we went through the pandemic. Social isolation is really hard. We are social creatures. We depend on that connection for survival in many cases. And generally, we feel like strengthening and maintaining those relationships brings a lot of meaning to life. So relationship of all kinds and social support is a big part of the pillars, and one that I really love to highlight, because it's not something that your doctor is often talking to you about. And I love this fact. So the lack of strong relationship increases the risk of premature death from all causes by 50%, which is crazy. I think that when you think of that, that's more than being obese or being physically inactive or smoking 15 cigarettes a day. So if you're not having connection in your life, then it really can affect your health. And so sometimes I tell my patients, like, if all you do at the end of hearing me talk is get off this call and check in with a friend or call a loved one or a family member, that's awesome, because it really will make a remarkable difference in your overall health when you feel that connection. And of course, being mindful of those relationships and connections that are not serving you. I think I like to highlight that as well. Okay, so why does it matter? We think that positive social interactions and relationships reduce the risk of depression and anxiety. And we also think that probably it works because when you feel supported, you're better able to manage the health conditions like blood pressure issues. And maybe you then, right, it sort of grows into, you have these healthy relationships, and maybe they encourage you to eat a healthy diet, or maybe they want to get you out and go for a walk. So I want you to start thinking about, about those connections and relationships and how to build those in your life. And then the last pillar is sleep. Now, the health goal is about 7 to 9 hours of sleep. This is high quality. I don't know where the Q got cut off, but high quality sleep. This really allows us to recover and reset, and it can be really hard. Night shifts, kids, lots of things can make this hard to achieve. So I like to highlight this as a goal. Right? I said I have 3 kids, and I rarely get 7 hours a night, but my life goal is 7 to 9 hours. And how can I create things in my life to make it possible for me to reach that? So it's also something worth reaching out to your doctor about if you're having trouble. Because adults who sleep less than 7 hours a night are more likely to report more chronic conditions compared to those who get 7 or more hours of sleep. And they're more likely to report being obese, physically inactive, and current smokers compared to people who get enough sleep. Sleep is super important. And some of these things are obvious. So why does it matter? Who cares if I get enough sleep? We're going to have more energy, better focus and attention, better mood. A lot of these things are pretty common sense because we've experienced it. When we don't get good sleep, we don't feel these things, right? More resilient, better metabolism, a healthy weight. And that's the last pillar. And I wanted to kind of connect it back here in this last one or two slides here. Because I've talked a lot about lifestyle medicine, and these are the teachings from the American Academy of Lifestyle Medicine. But these things have a lot of overlap with the American Institute for Cancer Research, and they sort of directly overlap. So there are key things that we know that can reduce your risk for recurrence or for other cancers, and those are things that Isaac mentioned. So kind of tying it all back in here, right? So eating a diet rich in whole grains, veggies, fruits, and beans, limiting consumption of sugar-sweetened drinks, limiting consumption of red and processed meat, limiting alcohol consumption, limit fast foods, being physically active. So these things all directly correlate with the research that we've already done on cancer and cancer survivors. So I wanted to highlight that. And then, Isaac and I are working on this. We're really trying to provide more resources and support for breast cancer survivors. We did a pilot with breast cancer survivors in Oakland, where we enrolled a cohort of people into this series. They had 8 lectures on these different pillars of lifestyle medicine. We also offered yoga classes and cooking demonstrations. Our goal was to provide that extra support for people who are going through really challenging time, and also to help reduce their risk for cardiovascular disease and cardiometabolic disease. So we're working on trying to provide more programs like that. And that is this slide. So Isaac and our big, broad team just submitted NIH grant submission to sort of try and spread that program across Northern California, and also to be able to create something that's scalable that we can, use in all states. And so we're really excited and committed to this work, and I'm so grateful to have been here with you today.
Thank you, Robin. 1 second, let me share my screen. Following up on what Robin just presented, I want to share an opportunity for people in Northern California, for breast cancer survivors after active treatment in Northern California that would like help implementing the healthy lifestyle changes that Robin just described. Zero Breast Cancer is currently recruiting for a Resilient Me Health and Wellness Coaching Program. It involves 12 free weekly Zoom sessions with a certified health and wellness coach, and more information can be found at the link in the chat at zerobreastcancer.org/resilientme. Next, I want to introduce our panelists. Dr. Lawrence Cushy. He's Director of Scientific Policy at the Kaiser Permanente Northern California Division of Research and leads the Pathways study. So if everybody could turn their videos back on and unmute, we will go to the Q&A. And if you have questions, please continue entering them into the chat. So the first question that I'm going to ask, somebody was wondering about intermittent fasting and how that plays a role in healthy diets.
I could tell what I tell my patients, but maybe the scientists here have a more specific answer. Intermittent fasting, I think, is a tool that I definitely will recommend in certain patients. I do not think that it really is super long-term effective. The best evidence that I have seen is if you just stop eating after 7 p.m. and then don't eat until the next morning. We don't, often the problem is that we snack and eat till right before we go to bed. So the most reliable, sustainable approach to intermittent fasting that I've seen in my patients clinically is just have them stop eating at 7 and then resume eating in the morning when they wake up. That's generally what I say. I have lots of other thoughts, but anybody else have a opinion?
I cannot speak to intermittent fasting. I've never done or seen research on intermittent fasting. I guess the only thing I would say is that in my experience, even choosing like one food to eliminate in your diet or one thing to add to your diet, and I know I'm kind of getting a little off topic here, but just having that ability to force yourself to think about what you're putting in your mouth and when you're eating, in and of itself can be very helpful and liberating, diet wise, you know. And so I think diets are tricky because not only do they need to be healthful diets, but they also need to work for you, you know. And so, but I think raising our consciousness around what we eat is also important. But as for intermittent fasting specifically, I cannot say good or bad just because I have not seen the research. Larry, maybe you've seen some stuff on this.
Yeah, I would say, I'm not aware of anything that's definitive one way or another. So, uh, but there is a lot of interest in that general question and sort of the timing of when one chooses to eat, regardless of what one eats. So anyway, it's a appropriate question, but unfortunately not one that any of us have answers to at this moment.
Thank you. I noticed some people are raising their hand, and I just want to let you know that we're not able to respond to people raising their hand. So if you put your question in the chat, then we'll try to get to it there. Somebody's wondering about non-fat and low-fat dairy recommendations, and if that's the thing for the best outcome or not. And mentions that it's hard to meet protein and calcium requirements without dairy. Also wondering about eggs.
I just say one thing quickly about dairy is that if you noticed in my slides that we have seen in our data, in the pathways data, stronger associations in that domain with better outcomes. The two indices that I highlighted as having, and I'll just say the two indices I highlighted as having the strongest associations happen to be the two that also encouraged dairy, where the others did not. And so I'm actually interested in dairy and exploring dairy more. I would say, like I said, according to the DASH diet, if you are going to choose dairy, choose a low-fat option. I do think there is some evidence to suggest that dairy may be beneficial, though I don't think we have enough data yet specifically on that to
Yeah, I might add, as far as that goes,
Yeah.
that there are a number of studies that suggest that increased dairy food intake or calcium supplements are associated with better blood pressure control, as well as lower colon cancer risk. So which is sort of not we haven't directly addressed here. So there may be some benefit. The low-fat dairy makes sense if you're going to be including dairy because of the type of fat that is included in dairy food, which tends to raise the risk of cardiovascular diseases. So that's anyway something to take into account. But yeah, there are more healthful, fat choices, some vegetable oils and that type of thing. So
we've got people wondering more about the relationship between breast cancer and chemo and radiation and heart disease. And I know we didn't go into that as much, so I'm wondering if you could share more about those connections.
So, I mean, I guess I could just briefly say, Larry, maybe you have more kind of thoughts on this, but the Pathways study has an ancillary study, the Pathways Heart study, that specifically looked at that question. And what they found was, and I'm just kind of reading here off one of the slides from one of their presentations, just because it's hard to remember, but they found, among women with breast cancer who were treated by, with chemotherapy, radiation, endocrine therapy, all three, compared to women with breast cancer, compared to women without breast cancer, had a higher risk of diabetes and hypertension. In terms of chemotherapy, specifically when they were treated with anthracyclines and or trastuzumab, as well as radiation or aromatase inhibitors, also higher risk of heart failure, cardiomyopathy, and stroke when compared to women without breast cancer. So those two studies really kind of zeroed in on that question. And those are two studies I believe are mentioned in the chat if people want to look at them more closely, and are on the slides that I presented.
Yeah. Also, I okay, my memory is a little fuzzy here too, but I think did you look at effective diets stratified by whether people received breast cancer therapies that are known to be cardiotoxic?
I did. And the first paper that we published on this, looking at specifically cardiovascular disease, the one kind of stratified analysis across chemotherapy, that's the cardiotoxic chemotherapy that I mentioned, the anthracyclines and trastuzumab, we did see a stronger connection, a stronger link between diet quality and cardiovascular outcomes in that group compared to the women who did not, which is interesting because if that group is at higher risk for cardiovascular disease, diet really may be one way to help mitigate that risk. Mm-hmm.
Yep. That was the point that I was hoping you to actually address that.
Thank you for
and Robin, and maybe you could answer this first if others have something to add. We've gotten a lot of questions about soy and tofu and if that's safe for breast cancer survivors.
Yeah, I get that question a lot. And I would say what I generally say in my clinical practice is that when we think of soy, there's lots of different ways it comes in the store and how we eat it and consume it. That best way to eat any foods, right, is unprocessed. So if you're eating soy that's minimally or very little processed, so that would be things like tofu or edamame, I feel very comfortable having my patients include those in part of their regular diet, many times a week. Once you get into the super processed soy products, the garden burger made of fake meat and the sausages with tons of salt and soy, it's like a totally different ball game. So because there's lots of other things going on in those, lots of additives, and so I think it's great to go ahead and eat healthy soy products like tofu and edamame and maybe even soy milk or tempeh, but to avoid the processed ones. And when we look at different populations around the world, populations that have very high soy intake actually have much lower rates of breast cancer. So I think when I think about that, I think I don't want to give anybody a reason to eat a beef patty instead of eating a tofu stir fry. Because most of the time, if we vilify a certain ingredient, then they're going to be looking to other sources that actually probably are worse for them. So yes, I recommend that people include soy minimally processed in their regular diet.
Yeah, I'll just add that the studies, epidemiologic studies that have looked at soy intake and survival after breast cancer or outcomes after breast cancer, they almost uniformly show that regular soy intake is actually probably better than avoiding soy. And that's even, in people with ER positive breast cancers or whatever. Just to follow up on Robin's point, most of those studies didn't specifically look at whether isolated soy protein or something like that might be harmful or beneficial, and have been based on sort of asking about tofu intake, or some of the more traditional soy foods. Some of them were conducted in China, for example. And so those point to those types of foods as potentially, or not, certainly not being harmful. So in the context of, anyway, food selection, if you have breast cancer.
Thank you. So somebody's wondering about.
I'm sorry, I just want to say one last thing. So Larry, also, wasn't there, some of the hype in the media around, soy being bad for people with breast cancer or potentially, leading to breast cancer? Wasn't there confusion around the type of plant estrogen that was potentially into the food or in soy, right? And that kind of got muddled. And I think even till today, I feel like I get people always asking me, but isn't soy bad for breast cancer, and my
Yeah.
understanding is that really was based entirely on kind of a media blitz around kind of misinterpreting what type of estrogen is actually in soy products.
Yeah, so I'd say less media blitz per se, but
Yeah.
sort of studies that actually really tried to look at this because soy foods are among the richest sources of isoflavones, specifically genistein and daidzein, which are these phytoestrogens, as people may have heard that term. And they have estrogenic activity if you look at them in isolation in tissue culture. But that divorces these compounds from how they may actually act biologically, particularly when you consume it in a whole food, sort of, or partial whole food. Whole food's not the whole soybean, but you can make it at home if you want from whole soybeans. Um, and and so when it's actually been looked at in epidemiologic studies, like I mentioned, we really see no detrimental effect, and if anything, a beneficial effect. Yeah, so I think that the way these compounds work when they're consumed in the context of the whole food diet, then it's different from what is the theoretical or actually demonstrated, I should say, sort of effect of these specific compounds resulting in proliferation of ER-positive breast cancer cells in tissue culture. So it's very different from how it actually works in the whole person. So yeah, yeah.
All right, thank you. So we've got a question about omega fatty acids and if there's a link between consumption of those and heart disease, and which to limit and which are okay.
I don't go ahead, Robin, if you got a good answer.
Yeah. Well, I would say in general, I think that my general approach to a lot of this is everything in moderation. So omega-3 fatty acids, I think, can be part of a very healthy diet, whether that's from fish or flaxseed oil or things like that, and probably have some cardioprotection. I know that the science actually has been up and down on that. So I don't, maybe Larry or Isaac can speak to that, but I do recommend omega-3s. And because I am a plant-based person, algae oil or flaxseed oil, other sort of not to mention the health of our oceans, I would stay away from the fish for me. But I think that omega-3s in general can be included in a heart healthy diet. Like anything, I wouldn't go to Costco and buy like 1 zillion capsules of omegas and like just take a bunch of them. I would try to incorporate it in your diet in a reasonable way and as part of a healthy diet overall.
Yeah, so when I see the question was omega fatty acids, they're not to get into the biochemistry in a lot of detail, but there are omega-3 and omega-6 fatty acids. Omega-3 fatty acids are generally the ones that have been thought to potentially be beneficial for cardiovascular health in particular. And those are the ones that are particularly, in terms of what we consume food-wise, found in fish in particular. So fish oils or fish oil supplements, will typically be, very rich in omega-3 fatty acids. And yes, the American Heart Association actually recommends, a couple servings of fish, per week or whatever. And so that's generally considered to be a reasonable sort of thing. The omega-6 fatty acids, which are linoleic acid as the most common that's found in foods. There's a little bit of controversy about, but those are relatively rich in plant oils. They also occur in, animal fats as well. But plant oils generally are considered to be beneficial, particularly from a cholesterol perspective. So also, those, if you're thinking about the oils, generally speaking, are probably reasonable.
Thank you. So we are at time and we understand if some of you have to leave, we'll stay a little bit after to still answer some questions. But I want to encourage you to please complete the survey after this webinar. Everybody will receive a follow-up email in a couple of days with a link to the survey and the recording. And our next Pathways webinar will be in spring 2025. So if you could please complete the survey, we'd appreciate it. Thank you for joining us today, and we'll continue to answer some questions.
Sorry, Leon, just to follow up, the one last point on the omega-3 fatty acid question, just to link it back to the dietary patterns work that we presented, just to mention that both the Healthy Eating Index and the Mediterranean diet both kind of encourage the consumption of fish, and I think the idea behind that is specifically for that reason. So just wanted to kind of point that out.
Thanks. We have somebody wondering about what to do if they've already been diagnosed with cardiovascular disease after cancer.
Well, I would say that you're not alone. I mean, a lot of people in the United States have cardiovascular disease. It's not an uncommon thing. And even more reason to engage in these healthy habits. I would approach it from there's lots to be done, lots of things that will make a difference in your overall health. So I think that's really common. I mean, I see that all the time. It's not like people come in just with breast cancer. They're often in their 40s and 50s and have other diagnoses that they're already dealing with. So I would say I see that a lot, and there's even more reason to work on these sort of overall healthy habits, and that they'll have a benefit for you.
Yeah, I mean, I think enrolling in a lifestyle medicine program would be a very good first step, and there's already been an option thrown out there. So yeah, I think it's never too late to improve your healthy behaviors, Plus, it'll just make you feel better, in general.
So we have a question about B12 if they don't eat animal products.
Okay. Yeah.
Yes.
Go ahead.
I can say, because I have to talk about that a lot. If you're a full vegan and you don't eat any animal products, then you should take a B12 supplement to prevent things like peripheral neuropathy, which is like a nerve type inflammation in your fingers and toes. So definitely you should take a B12 supplement. I would say most of my patients are not fully vegan, and so it's not harmful to take the B12 supplement if you just want to be sure. But generally, people are pretty good at storing and accessing B12. So even if you're eating meat, maybe a couple times a month, I mean, you're going to be getting enough. As we get older, we get less good at absorbing B12. So I am not hesitant to recommend it if you're at all worried about it, because if you get low on B12, the symptoms can be not good. So yeah, I recommend people take that.
Yeah, I was basically going to say exactly what Robin did. If you are totally avoiding all animal products, that a B12 supplement is not a bad idea, or foods that are enriched with B12. Some breakfast cereals, for example, are an example of that. So in any case, and you don't need to eat a lot of animal foods to meet your B12 requirements.
And let your physician know and get tested regularly so you can monitor your B12 levels.
Yeah.
We have a question about Ozempic for weight loss to reduce cardiovascular risk for breast cancer survivors. Do you have any information on that?
Wow, it's such a new topic.
Yeah. Robin, are you involved in any sort of either studies or clinical implementation of these GLP-1 agonists or whatever?
Yeah, so that's a big part, with the lifestyle medicine work that we're trying to incorporate, because the GLP-1, these medications, semaglutide, Ozempic, can be super helpful for a lot of reasons. But if we don't pair them with lifestyle changes, then often we won't see as much of a result. When they've studied this, the studies I've seen is that people will have twice the effect if they combine lifestyle medicine with the medication. So I guess what I would say is that medication can be really helpful for a lot of people. And I think starting with the lifestyle medicine changes first is a great place, because if you're on Ozempic but eating red meat or doing these other things that could increase your risk for things like cardiovascular disease and breast cancer recurrence, then it's not going to go well. So I would start with the lifestyle stuff first, because the medication only works when you're taking it. So you may see some remarkable health benefits, but if you stop taking it, or you're taking it and also doing things that are harmful for your heart, you're not going to see the maximum benefit. So we're looking at that, but it's very early, like Isaac said.
Somebody asked Robin specifically, in your lifestyle medicine program, does it suggest how to make healthy eating changes?
Yes, my take home for that would be start with healthy substitutions, right? You're not going to change you will feel super bummed out if you say you're going to change your whole eating pattern tomorrow, and tomorrow you're going to be a vegetarian or a vegan. Like, you'll just feel bummed out. So start by, if you can't let go of we think about it, the plate. If you can't let go of the hamburger and the fries, make sure at least half your plate is filled with veggies, some sort of veggie, something that has a lot of fiber. That's where I usually start. Just start by putting more vegetables on your plate, rather than thinking about all the things you're going to not eat. And so I have my patients start there, because it can be super overwhelming to think about all the things that you would need to change. And once you make those little changes, every opportunity to make a healthy substitution is great. If instead of getting the Coke, you get a water, awesome. All of these things add up over time, and they will be sustainable if you do it slowly, rather than, a flash in the pan where the next day you're vegan and the next day you're keto. Like, try to do slow things over time.
Thank you. Someone's wondering if there are processed foods that are better than others. Is it better to have organic chicken sausage, for example, than other forms of sausage, or how to make choices about processed food when it comes to that?
I mean, that's a great question. And I think in terms of the research that's actually out there, that's, is that I don't think we can make that distinction. However, I mean, that being said, I would certainly rather eat like an organic homegrown sausage than like, an Oscar Mayer packaged something, that you don't even really know what it is. But that being said, and Larry, unless correct me, I feel like the research that's out there around processed meats can't really make a distinction, between different kinds of processed meats. But that overall, that is what we see for anything that's considered, preserved or cured. And there's been a lot of work done on that topic.
Yeah, I generally agree with what Isaac said. I think, in terms of processed meats per se, the availability in the marketplace of things like processed poultry products is somewhat recent, and partly in response to the fact that studies had shown that processed meats, red meats, are really detrimental for cancer risk, cardiovascular disease, a number of other things. And so there's been much fewer studies on like processed chicken or turkey or whatever. So that's one sort of caveat about that. But if the methods of processing are somewhat similar in terms of creating a turkey sausage versus, a pork-based sausage or whatever, then it's probably not going to be that different. So in terms of ultimate health effects, although again, we don't necessarily have as much definitive information as far as that goes.
Mm-hmm.
There's also the question of, other foods that are processed, which, whether it's the, soft drinks, or whatever, things that you can't necessarily, make in your home from, sort of from the raw food ingredients. And there's a lot of interest on whether, these processed foods, or ultra processed in particular, have detrimental health effects. And so, yeah, we're trying to look at that. I answered one of the questions in the Q&A related to that, looking at, ultra processed foods and pathway study. But anyway, we're in the process of looking at that question. So, yeah.
Somebody's wondering about herbs, and I wonder if you have any insight into that.
Both. We did in the pathway study actually ask about use of various herbal products, botanical products, and that type of thing. But we have spent a fair amount of time trying to wrangle those data because, as you can imagine, people could potentially be using a wide variety of different products. So I guess the answer specifically in the pathway study context anyway is stay tuned. In terms of herbs, I mean, in general, there are potentially some that, are thought to be likely beneficial and others that might be harmful depending on the context.
Mhm.
So it's hard to say, to a general question about, herbs. So.
And then maybe our last question. Do you have any suggestions for people with a family history of heart disease that might also play a role in this?
I think it's the same. I think it's get involved in some lifestyle behavior changes because like when you think about it, what do you really have control over? In terms of your treatment. It's the choices you make in your life. And so I would encourage anybody who's concerned about their prognosis for whatever reason, to look at your lifestyle behaviors and see if you can get help through a program like the one that Zero Breast Cancer is offering, or Robin's programs, because we all have room to improve, all of us. And I'm always, since I've met Robin and learned more about the pillars and everything, like I constantly have that wheel in my head, as I'm eating and sleeping, and have I been doing enough for my sleep? Have I been doing a physical activity? And it's a great way to kind of keep tabs on, on where you're at. And so, but sometimes we need help. And so I would encourage that.
Yeah, and I think the one thing that I just say in addition is, it's not to say that if you're not following those 7 pillars, or anything like that, that you're not necessarily doing fine, or what's appropriate for you. But it is a way of being able to empower yourself in terms of being able to take positive steps. Yeah. So anyway, don't feel guilty if you're not necessarily doing one or more of those things, So, yeah.
Good point. All right, well, thank you so much to our speakers and panelists, and thank you to all of the attendees for coming today. We hope to see you in the spring when we have our next webinar. All right, thanks, bye.
Okay.